What do we mean when we talk about interventions? It is quite simple. Traditional medicine is built on the concept of intervention for something that has gone wrong. And not just gone wrong, but gone sufficiently wrong to the point of creating or causing symptoms. When one starts to have symptoms, most patients typically engage in self-help or self-treatment. When this does not relieve the symptoms, a doctor visit is usually the next step. A typical visit to the doctor these days, the procedures one can expect to encounter might be dramatically different than they were just a few years ago. Nowadays, many procedures may be hindered by the particular insurance coverage one has at the time. These interferences notwithstanding, I will explain what should happen with the initial visit or visits. The patient history should be obtained either by the doctor, an online form, email, or even telephone triage performed by a medical assistant. At some point, the patient and the doctor will need to have a face-to-face interview to discuss the symptoms and where they have come from. This leads to a physical examination and then either some treatment, what we like to call interventions, or some additional tests if the symptom generator has not been discovered or strongly suspected. These tests may include imaging, laboratory, ultrasound, etc. to find out or confirm a diagnosis. At some point, some form of treatment is recommended. We call this intervention. We hope it will help to reduce or remove the symptoms and restore normal function. In fact, if the symptoms are removed, are put into remission, most doctors terminate the interventions. Some will provide advice on prevention. Today, most healthcare facilities talk a lot about prevention. You will hear it even as a tool to reduce costs. Let's be perfectly clear with this. When prevention is discussed, it is usually not prevention actions at all, but screening methodology designed for early detection. This is not a bad thing. In fact, for the individual, it is a very good thing, and I recommend it be considered for a variety of areas. But I want to be very clear that it is not prevention. Even if something is discovered early, it was not prevented. Prevention is an action that will prohibit the onset of symptoms or disease. How many of those do we have? Sorry to say, but modern medicine has virtually none. Here is another point on which we must be very clear. Visiting a doctor, a hospital, or any other disease-based clinic may help you learn things that may aid in your body's ability to prevent the onset of symptoms. In that respect, perhaps we may be helping prevent something. So how do we actually prevent something from happening? The body is designed to do that, and is doing that all the time. In order to get to the point where this works as it should, we must first stop interfering with this mechanism. This takes a great deal of study and application of sound principles. We need our current medical system in all its wonders to reach a point where we have the absence of disease. This is important, and each of us must find doctors who help to do that. The procedures they use are called interventions. We need them, and we need to get them behind us as soon as possible. The road to health begins with the elimination of current disease and dysfunction. We may need doctors and even hospitals for this, depending on how far we have gone down the road to disease. So let me make this clear, that in our effort to achieve health, we need to investigate the benefits of modern care and begin right away to eliminate disease and dysfunction. Integrated healthcare is a concept that was first discussed almost 20 years ago by many wise physicians and healthcare facility administrators with insurance policymakers. It was a concept designed to put the right people in the primary care positions and deal with triage from the standpoint of what is best for the patient. In the state of Utah, 4 primary care providers were identified by the legislature: the medical physician, the osteopathic physician, the chiropractic physician, and the naturopathic physician. Each is uniquely trained to allow entrance into the healthcare delivery system and to route patients to the specialty best skilled to intervene with patient complaint. Intake is a procedure that every healthcare facility does to take you in as a patient. It is a good thing and you need it. But be aware that not all doctors or facilities are designed or even interested in getting you healthy. Some are, and those are the ones you need to find. Spend considerable time finding a doctor who will tell you how to become healthy and not just how to be a product of repetitive forms of intervention. Once you have found the one you are comfortable with, you should begin the intake process. Here we will help you with any interventions you may need, with the primary goal of getting you focused on your health. Condition management is a product of a history interview, which leads to a physical examination, which may lead to imaging, which also may lead to diagnostic tests. Once a diagnosis has been reached, treatment or intervention procedures are recommended and begun for a particular time frame. Then follow-up and assessment is in order to see if the intervention did what it was supposed to do. Although self-care is preferable in many cases, intervention is necessary to achieve a remission of symptoms. Once the symptoms have remitted, it is critical to begin your pursuit of health. Remember, the state of absolute health is a condition in which the body functions exactly as it was designed, and the immune system prevents the onset of any disease. As life progresses, the condition of absolute health gradually deteriorates due to various deficiencies, and the disease processes begin. After a while, symptoms appear. Some diseases show symptoms early on, and some do not. The presence of symptoms is not a good indicator of the state of health. As disease processes go unchecked, cellular death gradually progresses and organ systems become dysfunctional or fail, and eventually the body dies. Most people react to the symptoms and seek interventions in various forms. Here, we seek to achieve health and prevent the onset of disease.